Healthcare policy is absolutely an economic justice issue. As I mentioned, people are going to have to start making decisions about whether or not they want to put food on the table, pay for things for their children, pay for their healthcare, and those are impossible decisions. And it's also going to impact our entire community. And the federal decisions that are being made are essentially passing the buck to Virginia lawmakers. And Virginia lawmakers are going to have to start making some very tough decisions about priorities. There are some things that we can do at the state level. I mean, as Virginians, as constituents, as voters, we need to be making our voices heard. Certainly, we need to continue talking to members of Congress about reversing the healthcare cuts, about extending the enhanced premium tax credits, because bottom line is people are going to lose their healthcare. And we need to reverse course on this immediately. And at the state level, in terms of policy decisions, there are things that can be done. The state can consider our own versions of enhanced premium tax credits, essentially known as targeted subsidies. We can consider investing in our outdated eligibility and enrollment systems. Our systems in Virginia were created in the 1990s. It's 2025. People should not have to manually submit paper applications to Medicaid. We can also invest in the hiring, training, and retention of eligibility workers for the Department of Social Services. That number of staff has just simply not kept up with the number of people who have enrolled in Medicaid. And we need to think about revenue. As Delegate Munden King said, we do have a state reserve system and some unappropriated money that can be used to help backfill some of these funds, but that cannot be an ongoing solution. And those funds really should only be used for one-time spending. So there's a real need to look at innovative ways to raise revenue, a millionaire's tax perhaps, a fair share tax that requires or asks people with wealth to pay their fair share. And there are so many other options that we can consider in order to make sure that we are prioritizing the health and the well-being of Virginians.